We're also joined on the phone line by Dr. Rajeev Jayadevan, Vice Chairman, Research Cell, IMA Kerala State Member, National IMA Task Force. Sir, your reaction to the Prime Minister's announcement, and as Sanket pointed out, we're still waiting for more clarity on certain points as in which vaccines are going to be used for the teenagers.
Yes, it is a big announcement, welcomed by many people, particularly those who are working in the front lines and healthcare workers. This will be particularly important for certain subgroups. As we know, COVID-19 is peculiar in that it does not affect everyone to the same degree or same severity, or especially in terms of chance of death. So the vaccines are meant to reduce the risk of bad outcomes in these subgroups. So I would imagine these boosters to be prioritized, or third doses to be prioritized in those segments in descending order, which is pretty much what we did with our primary vaccination series, because India did an exemplary job in prioritizing vaccines in the right order and distributing them in the right order. So I imagine that same process will repeat or same principle would repeat in this third dose campaign as well.
Right, so and this is, as you know, it does seem that a wave or a surge of cases by the new Omicron variant is inevitable given what we're seeing in other countries. So the priority now to protect the most vulnerable, also opening it up for children so we can get better coverage.
Yes, Omicron is spreading around the world. It's, as we know, spreading rapidly, and it can even infect people who've been recently vaccinated. So this needs a vaccine plus strategy. But clearly, we need the best vaccine protection we can get, in addition to precautions to stop the virus from spreading, particularly in indoor spaces. We also need more data on the kind of protection that each individual vaccine provides against this particular variant. So we do not have that information yet on vaccines in India, and I believe that should be available within a few weeks' time in our country as well.
All right. Thank you so much, Dr. Jayadevan, for speaking to us here at NDTV. Now, as we mentioned earlier, Bharat Biotech's COVID vaccine, Covaxin, has been approved for emergency use on children between the ages of 12 to 18 by the Drugs Controller General of India.